Okay, so in this video we will be talking about interstitial lung disease, that is ILD. So what is ILD? What is definition? There is no standard definition of ILD, right? We have no set definition or criteria to define ILD, but we know that the diseases affecting the lung parenchyma are known as ILD. See, the part of the lungs that lies between the alveolar epithelium and the pulmonary capillary endothelial cells, this part, uh, the red area, this is called as the interstitium, and this hole is called as lung parenchyma. Any disease which affects this area, this red area, is called as interstitial lung diseases, although the insult comes from the alveoli itself or the alveolar epithelial cells itself, but the main area involved is the interstitium. What lies in the interstitium? There are a few fibroblasts or other inflammatory or the cells of immune system. They lie in the interstitium, and whenever there is any insult that happens from the outside, for example occupational exposure or pollution, the interstitium gets involved. There is triggering of the fibroblasts. They start producing more collagen, and fibrosis starts in the interstitial space, which is called as interstitial lung disease, right? So depending on the cause, we have classified interstitial lung disease. There are many causes and many kinds of interstitial lung diseases, which are differentiated on the basis of, first is the cause, second is the histopathological findings, and third is the what you see on HRCT or chest X-ray. Basically, chest X-ray is not able to differentiate between the different types, but yes, to some extent HRCT can uh, tell us a certain pattern which is pertaining to a certain kind of ILD. So how we have differentiated? We have here, basically we have ILD of known cause and ILD of unknown cause, right? In known cause, we have basically three causes. One is the exposure, right? Occupation based exposure. For example, someone working in silica industry or silicon industry, so those patients will be affected with silicosis. Asbestos industry, asbestosis. Similarly, berylliosis. Second is a drug induced, which is very much common for us, which is very much important for us to understand and to remember. What are the drugs which cause ILD? Very important is amiodarone and nitrofurantoin. We use in UTI, and we undifferentiatedly give it to everyone. But yes, it is very much important to know that nitrofurantoin can cause ILD. Methotrexate, busulfan, bleomycin, very important. All these five drugs are the most important ones that I have chosen for you. So these five drugs needs to be remembered at any cost: amiodarone, nitrofurantoin, methotrexate, busulfan, and bleomycin. Now there are a few systemic diseases which have effect in the lung also, and we know that most common diseases which cause ILD, apart from other systemic manifestations, are connective tissue diseases like SLE, rheumatoid arthritis, and systemic sclerosis, right? So these all are the interstitial disease of known cause. Now we have some unknown causes which can cause interstitial lung disease, uh, because they have no known cause. So we also call them as idiopathic interstitial pneumonias. The first example in IIPs is idiopathic interstitial pneumonias is IPF, idiopathic pulmonary fibrosis. Second is NSIP, desquamative interstitial pneumonia, respiratory bronchiolitis associated ILD, and cryptogenic organizing pneumonia. So there are few others also, but the most important ones are these five. Now there are some miscellaneous causes Or obviously these are also we do not know the cause that why do they occur, but yes, we have some miscellaneous causes like lymphangioliomyomatosis, or we can call it as lymphangiomyomatosis. These are seen in tuberous sclerosis. Second is pulmonary alveolar proteinosis. Third is pulmonary Langerhans cell histiocytosis. So these are some miscellaneous causes that come under the category of unknown cause ILDs, right? And unknown cause IIPs, that is idiopathic interstitial pneumonias, we have 5 of them. Idiopathic pulmonary fibrosis, non-specific interstitial pneumonia, desquamative interstitial pneumonia, respiratory bronchiolitis associated ILD, cryptogenic organizing pneumonia, right? So this is basically the classification. So epidemiology, how do they present? The age of presentation is mostly in the later age group, that is after 50 years of age, and males are affected more commonly than females. 15 to 20% cases of ILD have family history also, so there must be some genetic involvement also. So what are the genes that are there which cause ILD? There are two genes which are most commonly involved. One is the MUC5B, it is mucin coding gene, and second is SFPA2, surfactant protein production, which produces surfactant. Right. What is the pathogenesis? I have already told you in the beginning of the slides that there are basically fibroblasts which get activated. Where are these fibroblasts lying? These are lying in the interstitial space. This is the alveolar epithelium. This is the pulmonary capillary endothelium. The space between the two is interstitial space, and there are a few macrophages and fibroblasts also. Suppose the insult comes from outside, for example, pollution, occupational exposure, right? So there is activation of fibroblasts. What are the mediators involved? Mediators involved are vascular epithelial growth factor, vascular endothelial growth factor. There are few others also, growth factors also, like fibroblast growth factor, right? They are involved in activation of fibroblasts. They will secrete collagen, and collagen will cause fibrosis, right? So what will be the clinical features once fibrosis occurs? The patients will present to you with dry non-productive cough. There will be exertional dyspnea, and there will be clubbing. See, clubbing is not seen in all of the cases, but yes, clubbing can be seen in patients with ILD. The most common clinical symptom is dry non-productive cough, which is there from very long period of time. Chronic cough, non-productive cough. Exertional dyspnea, obviously, most common sign and symptom. Right. How will you evaluate? First of all, we will do chest X-ray to begin with. Right. It will give us a clue. There will be reticular shadows. So you will understand that this is not consolidation. This is, no mass is there, nothing like that. But there are some reticular or reticulonodular shadows, and the position is very much peculiar for ILDs. That is bibasal and biposterobasal. In the posterior part, in the lower zones, you will see reticular shadows that are very much suggestive of, uh, you it will create a sort of suspicion that the patient can have ILD. After that, we can do PFT, but unfortunately, PFTs are not able to differentiate between, whether it is ILD or whether it is COPD or obstructive or restrictive, because PFT will tell us only two things: either the disease is restrictive or the disease is obstructive in pattern that is there in PFT. But in ILD, we will see both kinds of patterns, restrictive as well as obstructive. So it does not specify anything. We do PFTs, but most of the times they are inconclusive. Fiber optic bronchoscopy. It can be used for lavage and biopsy. What will you see in lavage in case of ILD? You will see eosinophilia. And what will you see on biopsy? We will see honeycombing in most of the types of ILDs. We will see honeycombing. We will see, we can see, for example, fibroblastic foci in case of idiopathic pulmonary fibrosis. It is one kind of IIP, that is IPF. But the gold standard is HRCT, right? HRCT will tell us where is the lesion, what is the kind of pattern that is there in this kind of ILD, and based on the position and the pattern, honeycombing, you can, to some extent, you can identify the type of ILD. So the further management will depend on how do you diagnose, what is the diagnosis, what is the exact kind of ILD that you found, whether to give steroids, whether to give immunosuppressants. That is based on HRCT and histopathological findings. So that is all about the basics of interstitial lung disease. We will be discussing in further slides, in further videos, what are the different kinds of ILDs. One by one, we will cover all of the types of ILDs. So that's all. Thank you.